You're watching Chicago's very own WGN News with Dan Ponce, Lourdes Duarte, Aaron McElroy with traffic, Demetrius Ivory with weather, and Marcus LaShock. This is WGN Morning News at 4.
4:42 this morning. We are talking about a very serious subject today with veterinarian Dr. Tony Kremer. It's a disease that is killing dogs in the suburbs. And let me try to pronounce this correctly. Leptospirosis.
Perfect.
Did I get it?
You
okay,
got it.
Good. Very serious because there have been already some cases, in the northern suburbs?
We started out hearing about this in the northern suburbs, and then as I talked to veterinarians in our practices in the south and west suburbs, they said we're seeing a huge rise in this as well. This is something that is not super common, and to have a few pets succumb and have this be a fatal situation within a couple weeks is rare, but very, very concerning.
So what is it, and how does it spread?
Well, it's a bacterial disease, but it's not a wimpy bacterial disease. This is something that when they're sick, they need antibiotics for weeks, if not months, to get rid of it. And it shows up very much like any type of disease. They're tired, they don't eat very well, they're acting sick, it could be the flu, and if it's gone too far, it's something that we may not be able to fix. So I really, and how it spread, basically, it spread through mostly urine. It's wildlife, and that have this out there, like raccoons, deer, and pets can walk through a puddle or lick a puddle or something as easy as that and pick this up. And it's even an urban disease because rodents carry it as well. So it's something that even if your pet's in the city, it's something that you need to be worried about.
Can this be spread from dog to dog, Are people not going to dog parks and worried they shouldn't interact with other dogs in that way?
It can be. And then probably more importantly is this is a disease people can get.
Yeah, so how is it spread to humans then?
Well,
and what is the impact for us if we own one of these pets?
Well, it's not as bad as a disease in people. It's almost always curable in people, but certainly it's something that if we have a pet in our household that has this, it's way more likely that we would have a chance of catching it. And it's from contact. It's a bacteria that can be spread by just touching and even throughout the air. So it's something that it can be spread easily if the animal has it.
So you were saying before in the commercial break here that it's pretty easily prevented. So you brought in some things to show us here. What do you have here?
A couple of things that I want to just bring up are the fact that this is very preventable. There's been a vaccine for leptospirosis for dogs for 20 or 30 years. But in the past 10 years, people have switched over to 3-year vaccination protocols. This is not a vaccine that lasts 3 years. Even though you can get a vaccine for rabies that lasts 3 years, and some people go, oh, then I'll just go every 3 years. Things like leptospirosis need to be given every single year to dogs, and so it's very, very preventable. The other thing is, there are breeders out there that have told their clients, don't get the vaccine for leptospirosis because it might cause an allergic reaction. That's decade-old thinking. Okay. Vaccines now for this are very pure, very unlikely to cause any reaction, and very, very good at protecting them from getting the disease.
Okay.
Real quick, we're out of time, but is this just for dogs or cats as well?
Cats can get it, super, super rare, and there is not a vaccine for it. I guess the best thing to say is if either a dog or cat showed signs of lethargy, inappetence, get them to the vet right away so that we have the best chance of fixing this.
All right.
Okay.
Good.
Thank you.
Thanks so much, Dr. Tony Kremer. Appreciate your time. Keep up with Dr. Tony at drtony.com. Also on Twitter at DocTonyDVN.